السلام عليكم ورحمة الله. طلبة المرحلة الرابعة إن شاء الله تكونون بألف خير وصحة وعافية. نكمل محاضراتنا للفصل الثاني بالجنرال سيرجري، والآن حنتكلم عن موضوع الفراكتشرز، الكسور. A fracture is a break in the continuity of bone. It can be complete or incomplete مثل ما نشوف هنا بالأشعة. ممكن يكون كسر كامل in the whole diameter of the bone or partial depth in the diameter of the bone. So it is a breakdown the continuity of bone. It could be complete or incomplete. Fractures are the cause of considerable degree of morbidity and even mortality across all age groups. Patients suffer both in short term from pain and in the long term from disability and deformity. Etiology of fracture. A fracture can be caused by a number of different mechanisms, and this leads to a variation in the pattern of fracture. The vast majority of fractures are caused by an excessive force applied to the bone, causing it to break down. Biomechanics are the key in relation to bone injury. A direct force applied to a bone will cause a fracture at the site of impact. Indirect forces cause a fracture distant to where the force is applied, such as spiral long bone fractures. أحيانا ضربة مباشرة تؤدينا إلى مثلا تسوي depression فعصة بالبون، أو could break at the site of the impact, could make a breakage of the bone. وأحيانا indirect force مثلا shear force، عملية رفع أثقال معينة، ما تسوي كسر في مكان applied force، وإنما in a distant area from the site of force، وهذا ما يسمى بال indirect force fracture. So الميكانيزم of bone fracture، ميكانيكية كيف تحدث هاي الكسور، إما by direct force or indirect force. مثلا واحد ينضرب بالفك ينكسر الكوندايل، هاي يسموه indirect force، ما جت ضربة مباشرة للكوندايل. سترس فراكشر نتيجة جهد قوي، رفع ثقل عالي جدا، or pathological fracture نتيجة مرض، lesions موجودة بالبون تؤدي إلى fracture of the bone. ذكرنا احنا this types of fracture according to its complexity إلى درجة التعقيد البي could be simple fracture. A fracture is called simple or closed when there is no communication between the site of fracture and the exterior of the body، بمعنى لا يوجد جروح. Compound fracture. The fracture is called compound or open when there is a wound on the skin surface leading down to the site of fracture. من يصاحبه جروح لهذا الكسر. However, it must be stressed that the presence of skin wound and fracture of the underlying bone without any communication between the two is not a compound fracture. يعني لازم يكون at the site of fracture يكون الجرح زائدا الفراكشر of bone. In compound fracture, there is a risk of contamination of the fractured bone by the outside organism, while the closed fracture is free from this risk. يعني الدينجرس الأعلى تصير بالكومباوند fracture هو الكونتامينيشن، التلوث اللي صاحب الجرح للفراكشر سايت. مثل ما هنا نشوفه بالصورة simple fracture، بينما الكومباوند fracture يصاحبه wound in the surrounding tissues. Also a fracture ممكن نصنفها according to the etiology of fracture ممكن نصنفها according to the etiology of fracture. عندنا traumatic fracture. It forms the largest group of the term fracture, generally means traumatic fracture. نتيجة ضربة وقعة may be caused by direct violence. For example, fracture of mandible due to a blow on face, or indirect violence, condyle fracture due to trauma over the chin. Stress fracture or fatigue fracture. It occurs due to repeated injury occurring to the same site. It occurs in bones with normal strength. The mechanical structure of bone gets fatigued due to repeated trauma, and then the bone breaks. For example, fracture of second metatarsal bone due to prolonged marching in soldiers. الميتاتارسال بون هي عظام الأصابع للأقدام نتيجة ضيق أجلكم الله الأحذية أو المشي والركض لمسافات طويلة ممكن يؤدي إلى كسر بالميتاتارسال بون. Or causative factor الآخر هو pathological fracture. It occurs in a bone already weakened by a disease, and the bone gets fractured due to trivial injury or even spontaneously. أحيانا وجود السيست malignant lesions بالبون تؤدي إلى fracture of the bone piece or bone fragments. فهنا عندنا الصور. هذا اللونج مارشنج نتيجة حمل زائد bearing of high weights كله ممكن يسوينا أحيانا إما direct fracture or indirect fracture. The weakness of bone can be caused by many disease processes. The most common underlying pathologies for pathological fracture include osteoporosis and malignant infiltration of bone, either secondary or rarely يكون primary causative factor. Osteoporosis اللي هو هشاشة العظام, or malignant infiltration to the bone either by metastasis or primarily involved to the bone. ممكن نصنف الكسور according to the patterns, شكل الكسر, according to the patterns of fracture. عندنا we have transverse fracture, which is due to bending of bone along its long axis, and it is unlikely to become redisplaced after reduction. العفو. الترانسفيرس يعني the two surfaces of the long bone, the two surfaces تكون involved in the fracture. A spiral fracture, it is caused by twisting of long bone along its long axis. الأولى ترانسفيرس كأنه عملية يعني إصابة بالعرض أو bending of the bone, بينما السبايرال fracture twisting يلتوي البون along its long axis, and it is prone to be redisplacement after reduction. هذا السبايرال يكون in an oblique pattern. A third example or third pattern of fracture هو comminuted fracture, and it is due to severe injury that breaks the bone into fragments. وعندنا comminuted fracture يصير عندنا many fragments at the site of fracture. Compression fracture نتيجة ضغط caused by a force applied along the length of bone, and the bone collapses into itself. For example, compression or fracture of vertebral body due to a fall from a height. واحد يوقع من السطح فيصير pressure على compression على أجسام الفقرات فتنكسر. As the spongy bone is crushed, so it cannot be restored to its original form. النوع الآخر من الفراكشر هو avulsion الخلع avulsion fracture. It is caused by severe traction on a ligament that breaks the bone on which it is inserted. It is commonly seen in small bones attached to the strong muscles, for example patella اللي هي صابونة الرجل, which is attached to the quadriceps muscle. هذا هو avulsion bone or avulsion fracture. Green stick fracture, usually seen in children whose bones are flexible. An angulation force bends the bone at the cortex and breaks it at the other, thus producing an incomplete fracture. هاي هي صور هذا transverse linear oblique or spiral fracture. هنا اكو عندنا non-displaced, هنا صاير عندنا displacement of the two fragments of fracture, spiral, green stick والcomminuted fracture. fracture بالvertebrae body of vertebrae نتيجة crushed force or pressure on it. Healing of fracture. As soon as the bone breaks, the fracture begins to heal. Various stages in healing of fracture in a tubular bone بالlong bones. أول stage يصير اللي هي أشبه بالwound healing, stage of hematoma. The torn vessels form a hematoma between and around the fractured surfaces, and the ring of bone immediately adjacent to each side of the fracture becomes ischemic and undergoes necrosis. Stage of subperiosteal and endosteocellular proliferation. These cells are precursor of osteoblasts. They form a collar مثل الياخة of active tissue that grows towards the other fragment, and the blood clot is pushed aside by the proliferating tissue and gets absorbed. A stage of callus. The proliferating cells give rise to the osteoblast that form the immature woven bone of fractured callus. The mass of callus is visible in radiographs and can be felt as hard mass surrounding the fracture site in superficial bones. إذن أول شيء يصير عندنا البلاد كلوت، وهذا البلاد كلوت يصير به proliferation of fibroblasts، زائدا الأوستيوبروجينيتال cells، وهاي الأوستيوبروجينيتال cells will produce the osteoblast، واللي هو يكون أول علامة لظهور البون اللي نسميه woven bone، which become visible in the radiographs. Stage of consolidation. The woven bone gradually transforms into mature bone that has typical lamellar structure. يتحول إلى العظم الناضج أو اللي بيه الكولاجين layers lamellar اللويحي. و stage of remodeling. The bone is gradually strengthened along the lines of stress, and surplus bone is resolved outside the lines of stress. Thus, the bone is restored more or less to its original form. In cancerous bone, as the bone has uniform spongy texture and no medullary canal, there is a broad area of contact or at fracture site. So healing occurs without medium of callus. However, pathological events are similar to that of fracture of tubular bone. ما يتعلق بالكانسلوس بون يصير عندنا باعتبار يعني بون مارو، فيصير عندنا الهيلينج without the formation of a medium اللي هو البريدج الكالس الياخة إن صح التعبير، أو البريدج فور لهيكلية العظم بالمستقبل اللي حيصير. هذا ما يصير عندنا الكالس فورميشن in the healing of spongy bone. هاي هي خطوات الهيلينج، تبدي من الهيماتوما، البلاد كلوت، الكالس فورميشن، الووفن بون، ثم الووفن يتحول لاميلر بون والمارو اريا، وكيف يصير عندنا الريموديلينج اوف at the fracture site. Clinical features and diagnosis. شو نعرف انه هذا فراكتشر؟ طبعا احيانا يكون ظاهر واحيانا لا، تحتاج تاخذ نوع من الهيستوري in addition للكلينيكال ساينز اللي تشوفها. الهيستوري mostly there is a history of injury except for pathological or stress fractures, and the patient complains of pain at site of fracture. There is loss of function in the injured area. In the limb fracture, patient is reluctant to move it، يعني يتألم جدا لحركتها. The patient may complain of weakness in the limb or loss of sensation due to neurological damage. Examination: swelling and bruising at the site of injury، hematoma formation أيضا. They may be external wounds suggesting compound fracture. Localized tenderness at the site of fracture، وهاي هي العلامة الرئيسية بالذات من يكون closed fracture. Local temperature is raised due to inflammatory response. On limb movement, abnormal mobility or crepitation may be elicited. However, vigorous efforts should not be made to elicit this sign, as it causes severe pain and further soft tissue damage and blood loss. Examine for the neurovascular damages in the injured limb by checking distal circulation or any neurological defects. Painful attempt بالسكافويد fracture لما نتحركه صح هو حيصير عندنا abnormal mobility، لكن بنفس الوقت انت تتعرض surrounding tissue for more damages. Of course, radiological examination. The X-ray should include the whole bone, including the joint above and below. X-ray should be taken in two planes at right angle to each other, anterior, posterior, and lateral. Sometimes oblique view is also required to detect fracture, and the information provided by X-ray is shown. رأسا مباشرة إما تحس displacement of the fractured site or a line of fracture becomes obvious in the radiograph. Principle of management: انت صار قدامك حالة كسر، شلون تبدي تتعامل with such cases. Principles of management. First aid، أول شيء الإسعافات الأولية. At the site of accident, the aim of management is to keep the patient. أنت صار قدامك واحد بالبيت مكان العمل، صار عندك واحد أصيب بكسر، شو تسوي؟ So at the site of accident, the aim of management is to keep the patient alive and to minimize the chances of further damages. These measures include maintenance of adequate airway passages and breathing, maintenance of circulation to control bleeding, and the external bleeding is controlled by application of pressure dressing, using cloth, bandages, handkerchief, or manual pressure. The use of tourniquet should be avoided as it may impair venous return, causes increased bleeding. Moreover, if it's kept for too long, it may cause ischemic limb damage. The limb should be supplanted, supported, with whatever method is available, a piece of wood, plastic, umbrella, أي شيء قوي ممكن تسند limb fracture. If a spinal injury is suspected, the patient should be moved without rotating or بدون ما تدوره أو تميله لأن هذا حيسوي لك further damages to the spines. Treatment of uncomplicated closed fracture. The treatment of closed fracture أول شيء عندنا هاي النقاط الرئيسية reduction. Reduction should be carried out without any delay if vascular compromise is present and should take precedence over the investigation including radiographs. Provided the blood supply is unaffected, reduction can be carried out under more considered circumstances. Reduction is often not required. This is in the case with minimally displaced fractures where the process of remodeling will compensate in the long term. من ماكو حركة بالتو fragments still these two fragments are in the same line, ماكو داعي تسوي reduction حتى ترجع القطع to make them in one line. الريدكشن هي انه من صار كسر وداخلت قطعة فوق قطعة، الغاية انه تسوي تراكشن تسحبها وترجعها متلامسة هاي القطعتين مع بعض. And when the reduction is required, it is easily effected by closed manipulation, thereby minimizing the risk of introducing infection to the fracture site. It is important to provide adequate analgesia for reduction, and this can involve regional or general anesthesia to be given to the patient. These risks of reduction might outweigh the benefits where the displacement or deformity will result in no loss of function. الغاية انه ترجع القطعتين بنفس اللاين حتى to minimize deformity in the overall shape of the bone. An open reduction requires a form of anesthesia and importantly breaches the protection against infection to the surrounding wound of skin. Immobilization, تثبيتها, a degree of movement at the fracture site is beneficial for the fracture healing by providing stimulus to the callus formation. Splintage can be thought of as artificial callus put in place early on. It prevents excessive movement at the fracture site and relieving pain and keeping the fracture end in close proximity to undergo healing and union, and therefore minimizing deformity. So the aim of immobilization is to prevent movement and to prevent displacement and to relieve pain. Methods of immobilization. عملية التثبيت إما ordinary by plaster of Paris اللي هو الجبس الكاست or splint, or immobilization by continuous traction بالسحب. It is required for spiral fracture to prevent overlap of the fragments due to muscle pull. Immobilization by internal fixation تثبيتات الداخلية. It is done when the plaster of Paris cast or traction is unable to give immobilization. Also, it is used in case of fracture, requires open reduction. For internal fixation, the bone on either side of fracture site is exposed by dissecting soft tissues, and immobilization is achieved by one of the following ways. إما plate held with screws, بليتات وبراغي. Transfixation screws عبر transfixation screws عبر the whole length or the whole width of the bone. Intramedullary nail, circumferential wires, وايرات على محيطة. Or immobilization by external fixation. It is done in case of open fracture. من اكو جروح كبيرة، فلذلك لا بأس احيانا تستعمل external fixation. هذا الانتراميدولاري fixation بوري وينحط within البون marrow space of the long bones. circumferential wires وايرات ويثبتون، وإن كان هاي بدت نسبيا تدخل مو بالجو بونز. عادة يستعملون الآن السكروز والبليتات for immobilization of the fracture site. Plaster of Paris أحيانا to minimize the compression over blood vessels يستعملون باك سلاب. يستعملون باك سلاب بس من جهة backward of the fracture site. أيضا using plaster of Paris casts. The plaster of Paris are easy, cheap and safe. Modern plaster materials are light, waterproof and easy for the patient to manage. They allow the patient to mobilize and go home early and maintain the fracture in good position. However, they allow for a little movement, particularly at the joints surrounding the fracture, and therefore predisposed to stiffness. Plaster casts are most suitable for fracture that are شو كنا نستعملها من there is minimal displacement of the fragments of bone or have been adequately reduced and whose new position is stable. يعني reduction minimum they are already stabilized. The main dangers of plaster casts are if they are applied incorrectly. A tight cast can act as a constraint and hence cause a kind of iatrogenic compartment syndrome. يسوينا ضغط على blood vessels فيسوينا مثل compartment syndrome اللي أخذناه بالwound بالفاشيوتومي. ينحصر البلد بالfacial compartment. And often a back slab or plaster that does not go around the whole circumference of the injured part is applied. Pressure sores can occur within the plaster and skin breaks can be induced by the patient trying to relieve the itch in the plaster side. أحيانا نسوي له حكة للمراجع اللي حطينا له قالب بلاستر، يسوي له حكة يزعجه للبيشنت. Traction سحب. This is used to immobilize some long bone fractures. Force is applied along the long axis of the fractured bone, distracting the fracture ends and keeping them aligned. Traction devices can be attached to bone, skin or bandaging on the injured body part. External fixation. Pins or screws are inserted proximal and distal to the fracture site, and these anchors are attached to a rigid external skeleton or external device. This allows a unique manipulation and can also act as a form of localized traction to the device, or even provide a force compressing the fracture ends together, helping to bridge the fracture gap. نشوف هذا هنا، هذا يكون مثل الهيكل بحيث يثبت two fragments of bone و يسيطر على الجاب اللي بيناتهم، ويسوي لنا good approximation of the two ends of the fractured bony pieces. Wounds can be left open to drain and to be easily inspected with external fixation, and the skin reconstruction can be carried out around it. The types of fracture best treated with external fixation are those that would benefit from the above features, particularly fractures at risk of infection or with significant soft tissue damages such as open fractures. Internal fixation. This form of immobilization is achieved by open and operative reduction of fracture, which is then held in place by any number of devices, most of which are metal that are left in place and the wound closed over them. The variety of products available is enormous and includes pins, plates, and screws. The main advantages of this form of treatment is the accuracy of reduction, and that can be achieved and indeed maintained by the firm immobilization provided. In internal fixation يمنحنا يعني انت حتفتح اوبريشن وتدخل الرود مالتك الرود او البوري intramedullary، فبالحالة يعني انت يعني you will manipulate the fixation and the reduction of the fracture sites. However, the main disadvantage of internal fixation is the high risk of infection. And not only is the skin's barrier to infection breached at the operation, but the microorganisms also tend to stick to the prosthetic material. يعني وإن كان الآن ده يستعمل titanium rods اللي تكون highly sterilized and can be used safely with patients. Infection on metal implants is hard to clear, and as a little systematic antibiotics gets to the site. So other complications including fracture of the internal fixation. أحيانا يصير عندنا كسر بنفس internal medullary fixation, particularly if it takes too great a proportion of the load rather than the healing bone. بالذات من يعني كأن يكون يتحمل ثقل أعلى. مثلا أنت تستعمل قطر صغير بالفيمر فراكتشر، أنت لازم تستعمل قطر كبير، فهذا أحيانا ما يتحمل الوزن، ينكسر أحيانا هذا الانترنال ميدولاري فيكسيشن. النقطة المهمة الأخرى after healing of fracture هو rehabilitation. The results of fracture treatment is significantly improved by rehabilitation. It should begin as soon as treatment of fracture starts. The prolonged rest in an injured limb can lead to collection of edema of fluid around the fracture site, as well as muscle wasting, atrophy of the muscle. لذلك لازم ينصح المراجع شوية تمرينات بسيطة عليه يقدر له in order to prevent atrophy of the muscle. So the aim of rehabilitation is to preserve function while fracture is uniting, to restore function after fracture is united, and the two essential methods of rehabilitation are active use and active exercises. Active use implies that the patient should continue to use the injured part as naturally as possible, although rest is necessary in the early days following injury, but the injured part should gradually return to activity as soon as possible. Active exercises imply doing exercises of muscle and joints under supervision and physiotherapist. هاي rehabilitation يساعدوه يحرك ايده اذا كانت مكسورة، اذا كان الفيمر فراكتشر او الفيبولا تيبيا فراكتشر يعلموه يحرك قدمه شوية شوية. المهم يحاول دائما يحرك الأجزاء المكسورة قدر الإمكان to prevent muscle atrophy. Treatment of open fracture. The open fracture demands urgent attention as to minimize the risk of wound infection, and the principles of treatment are wound debridement, تنظيف الجروح, all extraneous material is removed and the dead and devitalized tissue is excised, leaving a healthy vascularized tissue. If wound is clean and is dealt within a few hours of injury, it should be closed privately. In case of dirty, severely contaminated wound with delayed presentation more than 10 hours إلى أن جابوا للمراجع, should be left open and dressed regularly, يتضمد بشكل منتظم. Once wound become clean, delayed closure is done. طبعا treatment of fracture, principles of management are the same for the closed fracture. However, open reduction and internal fixation of fracture should be avoided to prevent the risk of infection. If the fracture is unstable and unsuitable for treatment by plaster of Paris, external fixation by pins inserted into the bone fragments and fixed to a rigid external bar should be done. Complication of fractures. These can be divided into two groups. Complication related to the fracture itself, اللي هو infection as osteomyelitis, tetanus, and gas gangrene, delayed union, non-union, malunion, shortening, avascular necrosis. Complication due to associated injuries, مثلا injury to the blood vessel, في حالة يسمونها ischemia أو necrosis. Injury to the nerves, بالحالة حتقل الحركة عندنا paralysis. Injury to the tendons, أيضا حتضعف الحركة الأطراف. Injury to the joints, حتصير limited movement للمفاصل. Injury to the adjoining viscera, تمزق للأنسجة الرخوة المجاورة. Fat embolism, deep vein thrombosis and pulmonary embolism. طبعا الانفection can seriously impair the physiological process of fracture healing and is one of the most common causes of malunion or non-union of the fractured bone. طبعا infection is much more common in open fractures. Compartment Syndrome, ضغط على الأوعية الدموية وبالتالي reduction بالcirculation of blood. This phenomenon generally occurs within hours of injury and is associated with injuries in certain areas, whereas compartment syndrome is most commonly associated with fracture, and this is not always the case as it relates to soft tissue swelling. Delayed union, loss of function. In delayed union, fracture healing takes longer than expected, and this is predominantly a clinical diagnosis with a persistent pain and excessive mobility at the fracture site. Even under normal circumstances, radiological union takes longer than clinical union. دائما احنا بالراديوغراف نشوف there is radiolucency، فلا تقلق، هو دا يصير عندنا formation of woven bone ودا يتحول إلى mature bone. There are numerous causes of delayed union, and it is less common in cancerous bone than in cortical bone. Infection is a common cause, and the presence or absence of infection has an influence on its management. Other important causes include poor alignment of the fracture, inadequate reduction, ظلت عوجة, poor blood supply, يؤدينا إلى necrosis, and excessive mobility at the fracture site, ill fixation for the fracture pieces. Non-union ما يصير عندنا التئام. These causes, the causes of non-union are similar to those of delayed union, in addition to the interposition of soft tissue. A gap remains between the two ends of the fracture sites, which is radiographically visible, and it might be possible to see the medullary cavities have sealed off. Clinically, the patient has persistent pain and mobility with or without crepitus. يعني شلون الفقاعات تسمع صوت المكان السايت of fracture. On stressing of the fracture site. The diagnosis, therefore, both clinical and radiological. Treatment of abnormal fracture union depends on whether there is infection present, healing in the presence of pus and dead bone sequestra is unlikely, and surgical debridement with antibiotic therapy is often required. Loss of function. Uncorrected deformity can result in loss of function. إذا العظمة إذا صار هيلينج بس إيدها ظلت عوجة حيفقد وظيفتها لعمل هذا الطرف. As a relationship of no longer anatomical. Similarly, prolonged immobilization can result in soft tissue fibrosis, resulting in contracture, تضيقات. For example, flexion deformity. Other causes of dysfunction include muscle weakness or muscle atrophy and loss of ligament complexes. Avascular necrosis, where the fracture disrupts the blood supply to a piece of bone, it can undergo necrosis. An example of this هو الفيمورال هيد. ليش دائما يقول لك نخاف من كسور الحوض؟ لأنه رأس الفخذ من ينكسر هذا يجي له البلد من بداية رأس الفخذ، لذلك إذا يصير كسر حيصير عندنا سبليتنج بالبلد سبلاي بيها. That derives some of its blood supply through the femoral neck. And the head of femur can undergo late death, avascular necrosis. Following a fractured neck femur, particularly if the fracture is displaced. هاي الافاسكولار نكروسيس شلون الهيد اوف ذا فيمر يجي له البلاد سبلاي فروم ذا نيك، فاذا صار كسر بالنك حينفصل البلاد سبلاي عنه، لذلك might undergo avascular necrosis. Compartment Syndrome اللي هو يصير عندنا pressure of blood supply and حصر للبلاد circulation in this area، لذلك تنتفخ. مال يونيون نشوف صار عندنا يونيون بالفراكتشر بون لكن اعوج، عندك impairment بالريدكشن وبالإيموبيلايزيشن، اور نون يونيون ما يصير اصلا التئام باجزاء مكسوره للعظم. شكرا جزيلا وبارك الله بكم.